One of the main challenges of this district is that it is an aspirational district, meaning it's one of the most backward and needs to be developed. So that is our main focus, is how access to health can be helped.
Initially, when we came, actually this hospital was shut down in 2014 for lack of, personnel and doctors, and because it's a challenging place to be. So slowly over the past 8 years, we've tried to build services and look at what the needs are, and position ourselves so that we can be available to the people who access this hospital. The balance between quality and affordability. And towards that, when you're looking at getting qualified people to come and man the different departments and to get the place up and running and to build it to a certain standard, that can be quite challenging.
TB is one of the most common opportunistic infections, so we also always assess them for any lung problems, like if at all they have cough or whatever, or even otherwise. Every patient who comes, he has to undergo an X-ray chest and a sputum test. So that also tells us whether he has got any lung infections.
The other challenges, of course, are to do with our communities, which are impoverished. Levels of literacy and awareness are very low. So you often think you go to if there is a good healthcare facility, people should come to it because they need that facility. But what we find here is that for people, often it is not their need. They don't perceive their need for a healthcare facility like this. And we often have to, pursue them and convince them that we can help them. It is well known that tribal communities have a much higher sort of proportion of people with tuberculosis. And add to that, we have the challenges of good healthcare access, especially in remote areas.
क्या तकलीफ?
टीबी का तकलीफ।
कैसे पता चला टीबी के बारे में?
वो दवाखाना में गई।
Initially, in our two hospitals, we have X-ray machines, but we don't have radiologists full-time there. So reporting was always the issue. So all those abnormal X-ray we used to get in the OPD. But our medical officers are continuously changing.
We've been really blessed with the partnership with the government National TB Elimination Program, under which we are able to perform free TrueNat TB testing for people who come with symptoms that need screening. And our pickup rates are quite high. Through this partnership, the whole program is focused on ensuring and enabling people to get from diagnosis and then treatment so that they complete treatment.
AI is definitely advantageous for areas like ours, where access to health in the remotest areas is not possible.
So one of the things we have is Qure.ai technology, which is something that reads the X-rays. Apart from a doctor's eyes, you have artificial intelligence which is doing that assessment on the side. And this, I think, is a real landmark kind of technology for our country, because often there are real challenges on the ground for people traveling long distances, and whatever healthcare they access may not have the wherewithal or the competence to do an X-ray and to actually make a diagnosis of TB. So for places like that, I think this would be a life-saving tool.
In the villages, if the government were to say deploy portable X-ray, which could upload images onto an AI software like Qure, it would be advantageous for the primary practitioners or the secondary level practitioners who may not have experience in diagnosing TB to actually be able to diagnose and get patients treatment required at the earliest possible. Because one of the advantages now of the NTPE is that you can actually start treatment based on X-rays. And if the pickup rate increases and the interpretation is faster, means the patient turnaround time from say 2 weeks becomes maybe a couple of hours or even just a day.
It usually catches any abnormalities. So, and that we are able, at least it makes us alert that there's something, either it is normal or it is abnormal. So we are able to see the X-ray much better.
I think this is a platform for us to sort of prove that this is good technology, that it correlates well with what the patient is presenting with.
During the COVID time, actually Qure was a very big advantage for us, because most of our patients cannot afford a CT scan. And so Qure helped in a big way in identifying and risk stratifying COVID patients who actually needed treatment. So even on the basis of digital X-ray or imaging, we were able to predict what the outcome would be like.
Much of medical care is not reaching where it's required most. So mostly villages and remote places where we don't have doctors, we don't have machines or whatever. So if these things, these artificial intelligence, it will go a long way. Telemedicine in whatever form, all these sort of softwares for interpreting, these will definitely go a long way. There's no doubt about it.
Sometimes, there are hospitals where there are probably a hospital which is just run by an obstetrician and a general surgeon. And for them, it may not have been a part of their training to deal with tuberculosis patients. So in such setups, I think Qure really adds value.
Government should make it compulsory for all the diagnostic center to implement this artificial intelligence apps, so that this motto of NTP program to eliminate TB in 2025 can get solved very easily, because presumptive cases is the first indicator which we are supposed to keep track on.
When it comes to advantage to patients, advantage to the people who need it, that is what we have to think about and drive towards.
My interest in establishing the credibility of Qure in these sort of setups is because I see it as a great tool for getting a handle on the TB epidemic in our remote communities.